I'm Melissa Perry, Dean of the College of Public Health at George Mason University. It is National Social Work Month, and joining me today is Chair of the Department of Social Work, Dr. Emily Ihara. Dr. Ihara is a gerontologist, and she's an expert in ageism and the study of healthy aging. Dr. Ihara, thanks so much for joining us.
Thanks for having me, Barry.
Delighted to have you here. If I understand correctly, the estimates are that by 2040, 20% of all Americans will be 65 or older. That's a big number. That has a huge impact from a population and a public health standpoint. Tell me more about ageism. What is it and why does it matter?
Ageism involves stereotypes, prejudice, or discrimination based on age, and it involves all sectors of our society. It's pervasive in our everyday life, and it happens across the globe. So as early as 4 years old, children learn their own culture's stereotypes about age. And as they grow older, they internalize those ideas or those notions, and it shapes the way they view aging and view older people.
I understand that ageism can show up in a lot of different ways. For example, in the healthcare setting, how does it show up? How does it manifest? Why is it important?
Yes. So ageism in healthcare can be a life and death situation. It shapes the way patients are treated. It may mean underdiagnosing or incorrect diagnoses. It could lead to poor treatment or lack of treatment. Many of those notions of what people are saying, like some older people may not be believed that they're in pain or something like that. And so it can have really critical repercussions for their outcomes and their ability to lead healthy lives.
I can understand there would be a lot of judgments and a lot of misinformation that providers would inadvertently bring to the healthcare setting. You have been studying these issues for a long time, and I know you have a big paper that came out recently, fascinating paper about intergenerational mentoring. Tell us more about it. It sounds really interesting.
Yes, so the title of our paper is called Don't Treat Us Like Fragile Babies. And that was a quote from one of our participants, right? And it just epitomizes how they experienced the healthcare system. Oftentimes, older people are infantilized, they are treated like children, or they're not valued for what they're saying. And in this regard, the analysis that we did was really examining their perspectives of the healthcare system. So senior mentoring programs have been around since 2000, and initially, the goal was to match medical students, first-year medical students, with community-dwelling older adults. And in this program, they have interactions with each other. Some research shows that ageism is actually best addressed through education and intergenerational contact. So in this type of a program, they get to learn about each other. There are mutual benefits for both parties, and in this particular study, we found the older mentors really expressed their desire to give back to the next generation, to help guide future medical professionals, to help them understand what their experiences have been in doctors' offices, as patients, as older people.
Yes, it sounds like an incredibly powerful model that actually access and proximity and just a desire to understand each other and each other's experiences can make you a much better healthcare provider.
Yes.
This work is very enlightening. Is there anything else that you would like to tell us about ageism?
Yes, and taking it back to National Social Work Month, one of the core values of social work is recognizing the inherent dignity and worth of a person. I think that one thing that we can do as a society is to change our language. As an example, the use of the word elderly often brings to mind negative stereotypes, such as someone who's frail or dependent or helpless. And so what I often tell my students is to drop the ly from elderly and use the word elder instead. Elder is often used in many cultures as a form of respect, and it disassociates that negative stereotype of elderly. So that's one word is elder instead of elderly. And then another word would be to add the ER to old. So we're referring to people as older rather than old. It really helps to change our framing and how we think about the aging process. Since we are aging, all of us are aging every day, it's important to broaden our understanding of what aging means and to include all of the positive notions of how we age.
Makes a lot of sense. You really are giving us a lot of insight. As you're talking, I'm realizing on the one hand, it's very simple, changing our language so that it is not perpetuating misinformation and misperception. And at the same time, it's very profound as to how we actually could change our lens and understanding aging as a very normative and normal process.
Yes.
I'm so appreciative for this conversation, Dr. Ihara. Thank you very much.
Thank you.